had 2 blood clots that were on my foot that were taken out and stitched up. I had the stitches in for the approximate length of time that they should be. Once they were removed, the incisions opened back up to the point that I had exposed tendons. The recommendation and thought process was, let's do a skin graft on it, and that should work. After 30 days, unfortunately, the skin graft did not take. I'd had the blood clots removed in March, and here we are at the end of July, and I still had this open wound on my foot. At this point, I was desperate, and I would have tried anything. I was referred to the wound care team, and they said, I want to talk to you about hyperbaric oxygen therapy. And I'm like, okay, what is that? My sessions start out with, I go in, change out my street clothes into a hospital gown, and I'm slid into a clear dome-shaped acrylic chamber on a hospital bed. Once I'm in there and the chamber's closed, the oxygen starts to pressurize, and you feel popping in your ears, very similar to if you've flown and if you're ascending or descending. That popping lasts about 10 minutes, and then you're free and clear. And while you're in there, you have the option of watching TV, or if you want, you take a nap. The oxygen actually saturates your blood and your tissues, and that's going to expedite the healing of your wound. And then once you're out of the chamber, then they check your vitals, make sure that your ears are free and clear. I do this Monday through Friday. I mean, it's a huge commitment. It's a 2-hour session every single day. But after my sessions, I go back to the wound care team twice a week, and we look at my wound. I immediately have seen the process of the wound starting to close. I'd like to have my life back. I'd like to start living my life instead of just being alive. After all I've been through, to see this in a matter of 2 weeks that we're making some progress is really, inspiring.